So what we did is we looked at all the patients who come to our emergency department with an acute stroke. So that's a stroke within 24 hours, and we focused on ischemic stroke rather than brain bleeds or hemorrhagic stroke. When they came into the emergency department, in addition to the usual clinical stuff that happens, we gave them a questionnaire and asked them questions about, did you know you were having a stroke? What happened? And in collecting the history, some specific things such as, when did you first notice the symptoms? And did you come in as soon as you found out you were having these symptoms? If they didn't think it was a stroke, then it was not as likely that they were coming in. But at the same time, there were many people who said, I thought I was having a stroke, and they still didn't come in soon. It's really important because stroke is a devastating illness, and it is the #1 cause of disability worldwide, and particularly in the United States. And fully 20% of patients who have a stroke at 90 days are dead. Currently, the only treatments that exist for stroke are if you come in the early time period. So if you come within 3 hours, then you're eligible for a medication called TPA. And it's not that this medication can be used for all strokes, but there is a small number of strokes for which this medication can be really helpful. But the only hope of finding out whether this medication will be something that will help your stroke or not is if you come early. So time is really of the essence. Other treatments that might be helpful in the early time period include stents that you can put into the brain. There are a number of products made now where you can go directly into the brain and remove the clot, and those have to be done within 6 to 8 hours. So it's absolutely crucial that patients come early so that we can figure out whether one of these time-sensitive treatments can be applied. Definitely there is lack of awareness of the symptoms despite, our continued efforts to promote the signs and symptoms. So further education needs to be done on that. The second thing is, even amongst folks who do know the signs and symptoms, I think the knowledge that potential treatments are only available early on is lacking. The preventative strategies are all the usual lifestyle things, such as not smoking, controlling high blood pressure, not being overweight. There are other risk factors, including diabetes, which we may not have so much control over, but if one is diabetic, then they should manage their diabetes well. So in that sense, there are many preventative measures for stroke. Unfortunately, as you age, your risk of stroke increases, and there is a component that is genetic that one may not be able to do much about. I think the key message here is, if you think you or anyone else is having a stroke, it is absolutely imperative that you arrive to a hospital that can treat you right away. Stroke is an emergency just like a heart attack, and your best chance of coming out of it well is to present early to the hospital.